Welcome back. Did you know that stroke is the nation's 5th leading cause of death? While COVID-19 may be on everyone's mind, May is Stroke Awareness Month, so we're dispelling common stroke myths and sharing what you can do to reduce risks. Joining us now is Memorial Hermann Texas Medical Center affiliated UT Health Neurosciences physician, Dr. Angel Sharif, who's also part of the UT Health Stroke Institute. Welcome, doctor. It's nice to see you. And preparing for a stroke, this is something that I think a lot of our viewers may be surprised to hear, that this is one of the leading causes of death. So let's get into some of the signs and ways to, avoid our risk.
Sure, absolutely. Thank you for having me. So the important signs of stroke, we use an acronym, BFAST, to help explain what the important signs of stroke are. So B stands for sudden loss of balance. E stands for problems with the eye, so sudden problems with double vision or loss of vision. F stands for face, so facial weakness or facial droop. A is for arm, so sudden difficulty with numbness in the arm or weakness in the arm or drift in the arm. S is for speech, so sudden difficulties with speech, either expressing language or understanding language. And T is for time, so we say time is brain. It's critically important to seek care right away when one has signs or symptoms of stroke.
And wants to help reduce viewers' risks, dispel myths, and be ready. And these days, especially in light of COVID-19, you are taking precautions to ensure the safety of patients, employees, and physicians.
Absolutely. So one thing that we've seen is that our numbers in terms of the patients presenting with stroke have decreased over the past couple of months. And what I'm concerned about as someone who takes care of stroke patients is that people aren't seeking care when they should be seeking care because of fears about the COVID-19 pandemic. So we want to ensure patients that it's safe to seek care, and it's important to seek care because not seeking care for a stroke can lead to death and severe disability. So at Memorial Hermann, like at other hospitals, we're doing all that we can to ensure patient safety. We're screening patients and visitors when they come in and providing masks. We're making sure the rooms are cleaned. We're making sure equipment is cleaned in between patients, just to keep everyone safe.
And let's talk a little bit about how critically ill patients are diagnosed and treated. So I know there are a number of risk factors that may increase your risk of stroke, but is it true that really a stroke can happen to anyone at any time?
Right. A stroke can happen to anyone at any time, at any age, really. We're actually seeing stroke in young increasing over the past several years. There are important risk factors for stroke, though, and some of them are things that we can change, and some of them are things that we can't change. Important risk factors that we can't really change are things like our age. Stroke risk increases with age, and our sex or gender, so there's an increased lifetime risk of stroke in women. The things that we can change are things like high blood pressure, which is one of the most common risk factors for stroke. So it's really important to have your blood pressure treated, diabetes, high cholesterol, and then a normal heart rhythm called atrial fibrillation.
And if we do have some of these conditions, is it true that diet changes, lifestyle changes, exercise, that those things can all decrease our risk?
Absolutely. So diet and exercise really contributes to the risk of those other things that I mentioned. So, for example, high blood pressure and diabetes and cholesterol control, diet and exercise helps to avoid those things from developing in the first place. And if you do have them, it helps to control the numbers for blood pressure and diabetes and cholesterol especially.
Let's get into some of the myths. Some people have described a stroke similar to a heart attack. Is that a myth?
So the risk factors for a stroke and heart disease or heart attack are similar, but a stroke occurs in the brain, whereas a heart attack occurs in the heart. A stroke occurs when a part of the brain doesn't get enough oxygen, either because of a blockage in a blood vessel or because of a rupture of a blood vessel.
Another myth is that a stroke is a brain bleed, right? But that's not technically correct.
Right. So the majority of strokes, approximately 85% of them, are what we call ischemic strokes, and they occur when there's a blockage in the brain, either from plaque buildup or clot that develops. The other 15% or so are bleeding types of stroke, and that occurs when there's a rupture of a blood vessel or when a blood vessel bursts.
Another myth is that there aren't treatments to handle a stroke, but that's also untrue because there are a number of different things that can be done.
Absolutely, and stroke treatment and care has really changed drastically over the past several years. So for some time, we've had the clot busting medication, TPA, that people know about. And that medication is for ischemic type of stroke, when there's a clot or a blockage, and it really helps to dissolve the clot. And at hospitals, if you present fast enough, you can get that medication within 4.5 hours or so of stroke symptoms. The other treatment that really has been proven to be effective in the past 5 years or so is where we can actually go into the blood vessel in the brain and pull the clot out, and that really causes dramatic improvements and outcomes, and it really decreases disability that occurs with stroke.
It really is so incredible, the treatments that are available. I know earlier in the segment we did put up a graphic on our screen. I'm going to ask our control room just to pop that up again, just so we can be sure we have these signs. Again, that acronym is Be Fast, Balance, Eyes, Face, Arms, Speech, and Time. So remember this, folks at home. And very quickly, doctor, we have about a minute left. Of course, you do not want, you mentioned this earlier, but we can't stress it enough, that if someone is experiencing any of these symptoms, do not avoid care right now in light of COVID-19. You've got to call 911 and you've got to get in right away.
Yes, it's critically important to reduce your risk of disability and reduce your risk of death if you have stroke signs or symptoms, to call 911 right away.
And also, you want to seek the highest level of care. I mean, this is not something that people should just be going anyplace. You guys have a proven track record, including some of the procedures you just mentioned.
Right. So at Memorial Hermann Hospital, we have comprehensive stroke centers as well as primary stroke centers, where you will get the absolute best care for your stroke acutely and in the long term for stroke prevention.
And of course, we should point out that visitors will not be allowed, with limited exception, because of COVID-19. Thorough cleanings are happening, and patients before any surgery, they are tested for COVID-19.
Yes, that's correct.
All right, Dr. Angel Sharif, thank you so much for your time today. Stay safe, everyone. And for more information, you can visit memorialhermann.org/stroke or call 713-704-7100.